All right, welcome back, everyone. I'm Michael Stamatinos with the Advancing Healthcare Innovation Show. And if you're new to us, we are crazy passionate about healthcare innovation and adoption. So we are looking at folks that are truly innovating in their space. And two of the things that we're really focused on as it pertains to healthcare innovation, notably, is this concept and this idea of access, which is why the Advancing Healthcare Innovation Show exists. And then parlaying that with leadership. And our aim is to bring stories on innovation within healthcare, highlighting real people who are really truly innovating within our space. And we have an incredibly important jam-packed year with good content, with phenomenal interviews that are planned. So I just want to encourage you, wherever you're consuming this content, hit subscribe right now, and the content will come right to you. And I'd also like to encourage you to comment. And it's always nice to hear, what you think of the content, what you think of the conversations, and how they're adding value to you. And if the content is valuable to you, would you mind sharing this on social media with your network? I'm just incredibly grateful when this makes a difference. And ultimately, we're trying to really advance healthcare innovation forward. And even more grateful when we can bring more innovators and doers and executors into our community. And with that being said, I'm just delighted to introduce our guest today, Martin Dunn, the CEO of Gaine. Martin, welcome to the show.
Thanks, Michael. Appreciate the opportunity to talk to you.
Awesome. So let's just kind of dive in. I'd love for the audience to just maybe get a little bit more about your background and some of the things that Gaine is doing specifically within the healthcare space, and that'll just kind of kick off into the other onslaught of conversations.
Sure. So we are fundamentally, at our core, a data management company. And a few years ago, we set up a very vertically focused healthcare division so that we could take the experiences, the assets, the people that we'd put into various healthcare use cases, put them under one roof and continue to double down in that space. And the flavor of data management that we're involved in is master data management. And when we look at healthcare, that means pulling together information around providers, around service locations, members, patients, payers, and all of these interrelated entities that any one company would have multiple representations of internally. And more importantly, is reliant upon exchanging information with their trading partners. So there's a lot of organizations out there that are gathering data that's useful in care coordination or planning, network adequacy, and some of the other things that are going on within healthcare. And that's been the focus for Gaine for the last few years.
Fantastic. I mean, talk a little bit about, in terms of how you view innovation. I mean, how do you classically define innovation?
Yeah, I mean, I think that, innovation, there's a blog post that I wrote some time ago, beware the shiny new object. And it's because innovation kind of comes in a couple of forms. We have new technologies, and at the moment it's artificial intelligence. But we've lived through blockchain and big data and data mining. I'm dating myself here, going back 30 years to when data mining was going to change everything. So we have these concepts that come out that are true technology innovations, and then they go looking for use cases. We think of innovation of looking at the market itself, looking at the needs of the market, and how we can apply various bits of new technology to solve a business problem. So the business innovation that we're focused on may pull in a bunch of these newer technologies, machine learning, integration with blockchains and that type of thing. But we definitely don't look at innovation through the lens of those technologies. We look at it through the lens of the business problems that we're solving.
That makes total sense. So in essence, you view innovation. Innovation starts by the proper identification of a problem, and where does that problem lie on a stack of problems, and from a prioritization standpoint. Curious, with everything that's occurring, we're obviously still in the midst of the pandemic. I mean, how have you seen innovation shift? From the needs of your customers. What have been maybe some stories that you might be able to share, with the audience around that?
Yeah, and I think that speaks very much to the point that I was just making. We think about the way the market viewed telehealth, and it's the remote consults. And pre-pandemic, if you asked any of our payers or our provider clients, their thoughts on telehealth, they would have described it as something that has a place in the future. They were on a very slow burn. They were talking about, 2 or 3% of their consults, may leverage that technology. Then the pandemic comes, and all of a sudden it becomes 80% of certain specialties were doing telehealth. And when you talk to them now about that, would they ever go back to, the old way of working? It's like, well, no, we're going to use telehealth wherever we can. It's much more efficient. And I think that's a classic case of the ability, the technology advances required to make telehealth possible have been there for a long time. But it's very difficult to drive business from the technology. You need business to need the technology, and then for the technology to be there. And for organizations that have been investing in that technology, and where it's applicable, where it's not applicable, which is just as important, those technologies then step up and say, well, here we go, here's how we've prepared things for you. And that's very analogous with the way our business has developed over the last few years. We get asked often to comment on how we're using AI or blockchain. Mm-hmm. And, for us, it's yes, we're doing a lot of stuff with it. We ran a blockchain project 2 years ago to show how a system that was exchanging information could be seamlessly linked into a blockchain. That didn't make our entire solution blockchain.
Right.
It just said, for those people that are using blockchain for whatever justification that they have internally, you can now coexist that with more traditional data feeds. And that's kind of I think, in some ways, the setting the organization up as a vertical organization, focusing just on healthcare, mm-hmm. has allowed us to keep some of those shiny new objects in perspective, for us to get really deep into the challenges that we're solving for our healthcare customers, and then introducing those technologies as needed, rather than being led by those technologies.
Yeah. So, I mean, so people talk about, sort of an innovation, but there's always an aspect of the human side of innovation that requires people to change, and making things sort of fit the technology. What, in your line of work, I mean, how important has it been? And where do you see little wins occurring across the spectrum of communicating with customers? I mean, how important is that? I mean, obviously it's nice to have a solid solution. What have you found to be successful in your experience around actually driving that innovation forward? You mentioned about, one of our previous conversations around the fax machine. Maybe you can share a little bit about that story, but can you talk a little bit about sort of the human side of change that also sometimes needs a little bit of a nudge to move forward, and sort of the grittiness of innovation?
Yeah. So the conversation that you're referencing, it goes back to the fax machine. So one of the projects that Gaine is involved in is we provide the backbone, the technology, the operations support, and the software for really forward-thinking, extensive California statewide exchange of provider directory information. So we've plugged more than 120 provider organizations. So these are organizations that themselves control hundreds, sometimes thousands of individual providers and practices. So we've got those plugged into 14 different health plans and exchanging provider information. And this was a project, it was a number of years in the planning. One of the questions we had right from the start was how we were going to support fax machines and inbound fax information. And we held our line and said, well, we're not. Well, everyone up in arms. That's the way we do business. And we said, no, look, it doesn't make any sense. It's, you know, it's going to add, it makes it unsustainable. Blah, blah, blah. We gave all the obvious reasons why fax machines are not a great approach to exchanging information. That decision was eventually ratified, and it went through. And since that day, not a single company, not a single person has ever asked us whether we could accept faxes again. It just took somebody to say no. That's not the right way of doing it. Here we're going to do it. So I think that the adoption of innovation is driven at both ends of the spectrum. It's driven by those who absolutely want to use the shiny new object the minute it arrives. Those are super early adopters. And then you've got the laggards who just want to stick to the way they've always done things. And somewhere in between is the happy place. And that's where we try and concentrate our efforts. We try and align our customers and our customers' solutions to that happy place in between, is not held hostage by the way things were done in the past, but not overly ambitious using technology for the sake of using technology.
Yeah, I mean, there is. So speaking of using technology for the sake of using technology, have you ever found that, you know, oftentimes you go in and you're sourcing a problem, you're looking at a problem, you're diagnosing it, and you're crafting a solution, and that solution, the better part of the solution isn't actually technology, rather it's process? How much of that, you know, do you think falls into the parameters of innovation?
No, absolutely. I think that, you know, people, process, technology are always components of the solution. And it, you know, it varies in terms of which one is leading that and how they're balanced, but there's always components of people, process, and technology. And we have to help folks kind of think through the most effective way to implement a solution that's going to be future-proof, that's going to scale with where they want to go. And sometimes that means changing the people and their interaction. Sometimes it requires us changing the process. There's always resistance to change. And given the nature of the types of projects that we run, which are with larger enterprises, on the basis that larger enterprises have more data, more systems, therefore more problems to get out and go fix them, we end up dealing with multiple stakeholders, multiple decision makers in each one of these accounts. And each one of them has their own perspective on people, process, and technology. So there's a huge amount of change management goes into the planning and the successful rollout and support of these solutions. It's what makes it interesting, and I think it also speaks to why the vertical focus of an organization is important, because you really have to understand at a very deep and detailed level the current state, so that you can speak to the changes that are being proposed, whether it's people, whether it's process, whether it's technology, or a combination.
Have you found that there are times where you engage the client and they obviously try to put their best foot forward? Do you find that sometimes it's been difficult to get the truth from clients? And how do you go about getting the actual truth, to get the real actual state of how things are? Is that more from questioning, or you just, talk me through that? I mean, even if it's you or whomever else on your team that is doing that, but any kind of best practices, things like that might be useful.
Yeah, I think one has to get a good understanding up and down the chain of both the technology preferences, the process improvement approach. So understanding the way a company documents and goes about process improvement, the way they move people between different positions, the skill sets of the folks that we deal with. Are we dealing with people that are primarily wired like technologists that understand the business problem, or the other way around? And there is no one size fits all. As we move through different layers of integration, and because integration is something that can be very simple at the surface, I need to exchange this file of information with this company. Fairly straightforward. But when we get into, I need to exchange certain information with certain companies at certain times, with different levels of governance, different levels of data standards that are applicable in each one of these exchanges. They're just two different levels of sophistication of the same solution. And the challenge that I think that we have, generally speaking, are companies who are not necessarily looking at the innovation that they need to make holistically.
Right.
They're still going at it with departmental projects. And then you end up with a patchwork quilt of solutions and approaches. So part of our job, the way I see it, is for us to be able to go in any one of the situations that we're in, look at the very tactical short-term need that we may have been invited in to talk about, but make sure that we lift our head up and that we speak to the people that would also have needs, and then make sure that we're thinking about these projects, these initiatives from a strategic perspective. And that, to me, is part of innovation. I'm less impressed with somebody who does something very specific in a very isolated project using cool technology, as I am the company who says we are going to reinvent the way we exchange information. We're going to reduce our administrative overhead as a company by 5 to 10% over the next 2 years. And we're going to do that by stripping wastage and rekeying and needless errors and all the problems that come with needless data errors. When a company thinks about its investments in those terms, here is my business goal, this is what I'm going to do, and I'm going to do a series of things in order to accomplish it. We think of that as innovation, as opposed to, I'm going to apply a bit of blockchain technology to this particular corner of my technology landscape.
Absolutely. I mean, if you're so busy trying to learn the tricks of the trade, you may never learn the trade. And for you, you've kind of gotten back to the foundational fundamentals. Rather, you've never left them. You always knew that that's sort of what needed to be done in order for not only change to occur, but also for innovation to occur. So it sounds to me that the way that you've kind of defined innovation and laid it out is sort of, it could be incremental improvements done over long stretches of time that, have a clearly definable, goal as to where they want to do what's, in terms of understanding their intention. So what do you think is one of the, maybe like a use case, maybe a case study rather, that you can share with our audience, which is a global audience, about, maybe a project that you went into that maybe you were a little bit uncertain about, and it turned out that it was, maybe it blew away your expectations. Do you have any stories or that you might be able to sort of share around that?
I mean, yes, there are several that come to mind, but I'm going to go back to this California statewide initiative because I think it challenges. It's innovative in that it is data integration across an entire ecosystem, and we know from experience that companies struggle with integration of multiple departments, because you have different opinions, you have different budget cycles and priorities, and there are a number of reasons why people don't play nicely together within a company.
Right.
Could be technology, could be politics, could be budgets, could be regulatory restrictions on certain systems. So we know that they exist. And that's part of the challenge of doing something enterprise-wide within an organization. But what I think we've really pushed the boundaries is here in California, we're doing that level of integration across companies. So not everyone that's plugged into this infrastructure has their own internal challenges of the information they're going to share. And then they still have to deal with the opinions which are totally out of their control of their trading partners. And you have to put all of that together. And I think that as we've kind of gone through that process, one of the light bulb moments for me was when we were having an early planning stage. We'd run kind of a soft launch, and we got some of those participants together to talk about the challenges that they were experiencing. And we sat in these sessions, and we put a health plan in a working session. And these are like, 15, 20-minute sessions. We've got everyone together under one roof in a room pre-pandemic for a couple of days to do this kind of working session. And one of the breakout groups, we got the health plans together with the provider organization that they were struggling to exchange provider directory data with in a facilitated session with one of us in each one of those sessions. And it was incredible to me that these are companies that had done business together for 20 years. That conversation that we had, the two of them sitting across the table, talking about their observations of each other's data, was the first time they'd ever spoken about each other's process.
What got in the way of them not doing that? That's baffling to me that took that long.
Well, it is when you look at it, through that lens of, well, here's this health plan, and here's this provider group. Why have you guys not had this? Can't believe you're only having this conversation for the first time. Then you look at it from their perspective, and the health plan says, well, we contract with 100 different groups, so we couldn't have this conversation with every one of them. And then you look at one of those provider organizations, say, well, hey, we contract with a dozen health plans, and we don't get to control the health plans. The health plans in this particular scenario have more leverage than the provider groups themselves, so they tend to call the shots. So it's easy to see how those organizations haven't made it a priority for them to solve their data integration, or to at least understand some of their data integration options by having an understanding of everyone else's business process. It took a technology platform that allows the exchange of this information and a very specific onboarding process that we use to map someone into that process that started to map out some of those understandings. So even though we've brought a tremendous amount of very sophisticated technology to solving this problem, some of the innovative breakthroughs were just at that human level. Customer A meet customer B. You guys have been in business for a while, but customer A, why don't you explain to customer B while the file that they send you is so difficult for you to turn around? And then vice versa. These are all parts of, and you go back to the people process technology. All of these are integral parts. You can't have a successful solution unless you cover all three of those corners of the triangle. To me, as we go through those processes, I just find it one, encouraging that technology knocks down a small barrier that opens the floodgates to communication, which then leads to better outcomes.
That's right.
But it does make the question of, back to our original question on this, what is innovation? It's enabled by a lot of things. It shows itself in a number of different ways, but they're all interrelated.
Absolutely. It sounds like what the value, the real value, that either it's a tipping point, an inflection point, was you in your organization being the bridge in that instance, and being the connector and providing that access, on multiple levels, whether it be from a technological perspective, but on that level, it's more sort of connecting on a human level, and then that sort of allows to pave the way for the rest of the change and innovation to occur down the road. On the contrary, I would imagine that you've been an entrepreneur for a while, and you've probably taken your fair share of hits. What do you think it is when things go sideways? What's the biggest reason as to why things go sideways, and how do you get things back on track?
So there are two areas that we look out for that we would consider to be red flags in terms of delivering customer success. One of them is the use of technology for the sake of technology. And those projects ought really to be assigned to an R&D type of function, as opposed to trying to address an age-old problem with the next newest technology. So we look out for that as one area of one red flag that we go looking for. I think the other is when customers underestimate the scale and complexity of the eventual solution, and their comfort zone is to start small and simple. And the things that work for small and simple problems don't necessarily scale to the big enterprise-wide solution. And we've had over the past 25 years that I've been running software companies solving these kind of enterprise problems. Oftentimes, we've lost some deals where a customer said, I just don't get it. We think we found a solution. This is the way we're going to go. And we've left the customer and said, well, here are the challenges which we would advise you to look out for. And we'll come back a year from now or 2 years from now and just check in. And some of the biggest, longest standing, some of the biggest deals and longest standing relationships that we still enjoy here at Gaine are from companies that didn't choose us to begin with. And we gained a lot of credibility and a lot of trust with the customer by saying, respect your decision. Here are the things to look out for. And then when those things occur and they run into that dead end, it's so much easier to go back now in that trusted advisor role and say, okay, and here's the path out of that situation. So I think that as long as you don't run into you don't have this ego in the way from anyone around the table, because sometimes people will stubbornly dig in and try to make whatever they've started with work. Those who go off and experiment, whether it be with new technology, whether it be with a simple solution or not, if they're prepared to learn those lessons, then step back and say, okay, now how do we do this at scale? In my view, those customers are more successful long term.
Yeah, I mean, they have a level of openness, someone who has more or less an open mindset as opposed to someone who has a fixed mindset. And it sounds like what you've been able to do is take note of those. And if something it doesn't end up going your way in terms of a deal materializing, it sounds like you're in allowance of that. And what you place at the forefront is hey, this is what you think is best for you. Okay, I'm comfortable with that. But you know what? Let's continue to stay in contact. Just because we haven't, executed an agreement on a formalized basis doesn't mean that the relationship needs to cease. And I think that level of openness allows you to be able to be flexible, so that when things don't go right for that, lost opportunity, maybe, they boomerang back, and like you said, they're longstanding customers because you wanted what was best for them from the beginning. They realized that, and maybe it's just a matter of time. That doesn't always happen that way. I mean, we wish it would, but it's good to hear. It's good to hear that you have that level of approach, that level of leadership and philosophy, especially given that I think leadership matters now more than ever, um, especially given the situation that we're in. So let me just ask you this. I mean, what's the one piece of advice that you would give someone who's running a tech company? Given that, look, we've got four kind of types of audience members that are listening to this. We have the healthcare entrepreneurs. We've also got folks that are in innovation that are on the payer side, folks that are in innovation on the provider side, and then we also have investors that are very digital health oriented. So, I mean, if there's one bit of sort of one golden nugget, one takeaway that you want to kind of drive home, Martin, what would that be?
I think to stay abreast of and stay aware of emerging technologies, but to keep them in perspective for the business value and the business solution that you're trying to provide. And I think if you get that balance right, where you're investigating and understanding on behalf of your customer base the true applicability of some of these technologies, and without getting seduced by it all and believing that there's a silver bullet out there for everything, I think you'd go a long way, and I think your customers will appreciate the R&D work and the work that you're doing on their behalf.
Fantastic. Martin, what's the best way for folks to kind of continue to follow Gaine, to keep up to date on your guys' progress and traction? Just sort of share with the audience, just so that they can keep you in mind.
Yeah, the gaine.com or gainesolutions.com, GAINE.com. Through the website, you'll be able to find us and see some of the things that we're up to. Yeah, I appreciate the opportunity to wax lyrical about some of the innovation that's coming and the way to apply it.
Yeah, no, it's been a real pleasure, Martin. Thank you for doing that. And just to the audience members, if you found this valuable, like it, subscribe to us, share it, comment on it. And if if you mention us and you spread this out on social, we'd love that. So look forward to seeing everyone here on the next conversation, and stay safe. Bye for now.